attach another filter here. You attach a needle to the filter and you directly poke into the IV.
That's what I'm asking you.
Give it always with more, because more the dilution. Suppose there is any kind of reaction, we have not seen till today, but in case you already have fluid which is diluting.
Suppose I have the 500 ml RL and then I add the exosomes. Which vitamin can I add to it?
So you can add all the vitamins, no problem, vitamin C. So again, the vitamins have to be chosen as per the patient profile. If the patient is hypertensive, okay, we'll add magnesium. If the patient is having low blood pressure, hypotensive, then we will not add magnesium. So like that, depending upon the this, you'll have to do the IV. Now IV is a different science in itself. It's not that, okay, you add this 1, 2, 3, 4, 5. For every person, the IV choice will be different. We can add exosomes to the IV. Why? Because exosomes in itself are present in the blood. And what are we adding to the blood? Vitamins, minerals, and RL or NS. So if it is there in the body, it can be added here. And the more the dilution is there, it's always better. It's like if you get a drug reaction, what is the first thing you do? You dilute the blood, right? You put more normal saline or something to dilute it. Same way, you always dilute. So in case there is a reaction, they have, safety purpose. We have never seen a reaction as of today, but you say you never say never. So you don't know when it could happen or will happen. We never know. Even the most safest thing, you could get a reaction. You can get a reaction to even xylocaine. You can get a reaction to even the tape also that you put.
So the safest vitamin would be best where we don't have to worry about the BP of the patient, blood pressure.
Vitamin C.
Vitamin C.
Because sometimes with B complex, I have seen people get little bit shivering and all that.
And if she's a hypertensive, how can I push it at the speed of 400 ml per hour? Is my question.
No, then it is different, no? Then you will give magnesium more, and then you will not use RL in hypertensive. You will use NS. So that's why I said molality and fluid science is important when we are talking about IV. Huh?
Why don't we stick to normal saline only for all patients? Why are
So see, it all depends on the patient. Now when the patient is coming to us, they are coming for many conditions. They are already taking some IVs. Now the patient can't come again and again. And how many times can you prick the patient? So as he said, if the patient is hypotensive, usually volume expansion can happen. So we'll give the volume expansion. Patient has a lot of fibromyalgia, then you give RL, because RL is the lactate, helps the fibromyalgia, helps the muscle fatigue. So that's why you will give RL. Where there is no muscle fatigue, nothing, to give normal saline. So looking at the patient and at the history of the patient, you always choose the fluid. In a non-diabetic, you will not give DNS. Patient is tired, exhausted. Usually many of these patients are on 1 meal a day, no meal a day, God knows what diet. In such patients, you can know they are a little bit hypoglycemic. Then I would give something with DNS. So that some sugar is also there in the body. But if he's a cancer patient, I'll not give DNS. Because cancer will get worse with sugar. Is there any pain or anything? No. Comfortable?
Autologous exosome, this is your own serum into your own face. So majority of the time, majority of people ask me, where can I not inject? So usually it's the aesthetic area where you do not want to inject would be the nose area, the peri-arm, the tear trough, okay, the nose area, okay, peri-oral, okay, and then your glabella and your temple. That is where you have to actually be careful. But again, if you hit it as well, it doesn't matter because this is actually exosome. So it's your own material. It's not Botox. Okay, that will actually burn your nerve or create any drop. Okay, so there's actually no worries. You can inject wherever you want to inject. Okay, again, this is a signaling factor. How do you want to inject it? You want to inject in a way that it's actually creating a bleb. So, do you do intradermal or you do subcutaneous? Intradermal, because subcutaneous is more deeper. Okay, so intradermal, the area of injection would be 10 to 15 degrees only. Okay, and directly go into the area that you want to go. Go according to the face plane. You want to go up first, you go up, and then you slowly go down. You go in a round or circular area or opposite circular, so that you know where you're moving. How much exosome you want to put is really up to you. Depends on the patient tolerance and the pain. So Dr. Vidya has already done anesthetic on her face for at least 1 hour just now. Okay. So right now we'll do an aseptic. We'll put a little bit of povidone iodine to make sure that the area is aseptic. Make sure you pastikan you jangan kena the white mata lah. Okay. And then after that, we will put a little bit of alcohol to clean the area, and we'll straight go for the injection. Is that okay? So no more explanation, I'll straight go into the injection. Okay, so the injection, I brought this needle from Korea. Okay, so this needle is actually size 32. Okay, and then I also have 34, even smaller, and I have 30. Okay, so for lesser pain, we of course use 32 and 34. Okay? Let's go. I need the
Paste bin and sharps box, keep it available always, because in case we keep it available there, we will have problems later. How to prepare the site? Identify the site and stretch the skin strongly.